Okay, thank you everyone for joining us this morning. My name is Lynn Voss with Golden Care. I have been in a marketing support role with Golden Care for many years. I'm going on 16 years now. My role has changed slightly over the last year, in that I am now the um, senior marketing specialist, but I still do a lot to support the marketing efforts of the regional directors. I still help with quotes, sending hard copy materials, product education, um, you name it. It's whatever we can do to help support you as our agents to succeed in selling some of these insurance products. So one of those products in our portfolio is GTL's short-term home health care plan. And last fall, there were some enhancements made to the product. Today, I am joined by GTL's Assistant Vice President of Sales, Greg Esposito. I'm going to go ahead and turn it over to him. Now, correct me if I'm wrong, Greg. You've been at GTL for 23 years now?
Yeah, it sounds like you and I, Lynn, are both rookies, right? I mean, we've only been at our places 16 and 20, 23 years this January for me. And,
Wow, yeah, yeah.
that's not a strange thing at GTL. My coworker Dimitri's been here 19 years, Carl 9, and our underwriter retired a couple years back, but he was here for 47 years. So it's
Oh,
not
wow.
uncommon. Really good, really great company to work at, and is evidenced by people staying here quite a long time. And one of the cool things is our sales support staff. My assistant Sue's been here 25 years. Kelly and Paul have been here over 30 years. So a lot of knowledge there when you call sales support for any type of assistance.
Yeah, I can attest to that as well. I love reaching out to the GTL team. No matter what, I'm always, can I say treated like royalty? I'm not, I'm not sure,
Oh,
but
you
we have
can.
such a good
Well,
working relationship.
well, that's great. That's what we're trying for here. And we're a much larger company than we were 20, 30 years ago, but we're still not a behemoth. And so we have to separate ourselves somehow. So we try to do that with great products, great customer service, and great agent service, and really just doing fun things like getting policies issued in a couple minutes, paying claims very quickly. It's just kind of things we can specialize in being a smaller company. So that's all well and good.
All right. All right. I'll
All
let
right.
you take it away.
Cool. Yeah, so today's a fun presentation. So I did a little bit of a hybrid. The normal presentation for this product to go over everything is about 45 minutes, but we wanted to condense this a little bit. One, because we know some of you have been selling this plan and you just want to know about the upgrades and the details. And then I'm just assuming that some of you may not be super familiar with it. So I'm going to talk a little bit about the product, just the product as a whole too, and then the upgrades too along the way. It is definitely called short-term home healthcare insurance, and we have some creativity at GTL, but when it comes to naming products, not so much. So we wanted to come out with a short-term home healthcare plan, so we called it short-term home healthcare. So not a lot of creativity there, but what we do specialize in at GTL is creating ancillary products. So when your clients have a need, have co-pays, out-of-pocket expenses, even if they're using their main insurance plan, usually our products can go a long way to helping keep their bank account intact. With regard to the plan we're chatting about today, we launched it in 2018, and last fall, as Lynn mentioned, we did an upgrade on the plan. Same name, different brochure, and some of the changes that we made are coming up on your screen right now. And a lot of these changes actually were, given to us by agents who are selling the plan, and we're like, this plan is amazing, but if it had this, it would be better. And then we did make a massive change, addition to the plan last fall by adding a caregiver cash benefit, and even more important than that, a caregiver support benefit. So not a support benefit for the person who's getting care, a support benefit for the family member who needs it to keep them from being stressed out and help them take care of things along the way. So really fun stuff to chat with you about today. Of course, something to mention, if you're not using it already, use the consumer video to show it to your clients, even to prospect for the product. Our infographic works great too. I'm going to share the video with you in just a minute or two. Also want to mention to you, you're probably familiar that our e-app platforms instantly underwrite and issue this business in a couple minutes, but we did launch something called text to sign last fall, which is great. So if you're not with the client, you can still do an e-app, and with text to sign, you can actually send them a text via GTL's technology right to their cell phone, and when they open up that text link, it turns their cell phone into a signature pad, and then you can get their signature right on the application that way, and that will alleviate any need for that verification phone call that they used to have to do if you are not with them in person. So the e-app platform is really cool. If you're with them, they sign your device screen and they're all set. If you're not, use text to sign. They'll use their own mobile device to sign it. So really cool technology. Just want to pass that along because it's become obnoxiously popular, and the verification call, while still available, is rapidly become a thing of the past. With regard to our latest state availability, what you're looking at the screen here, all of the states that are highlighted in teal have our latest short-term home health care plan available. The ones that are not highlighted do have our former short-term home health care plan available, and I think over the next few months we'll attain, the rest of these that are not highlighted, and they'll start using our latest plan too. So the target market, really quick with this plan, if you're not familiar with it, if you've got clients that are taking prescription drugs, which is pretty much all your clients, and you also have some clients that haven't planned for future care, they don't have a long-term care plan, maybe not even a short-term care plan, but they at this point can't afford a long-term care plan, or maybe health-wise can't qualify for it. Well, now what do you do? Well, we know most people want to recover at home if possible, so this product may be a really good idea for them to take a peek at. Another target market you may not have thought of. I'm a perfect example. I'm 59 years old. My parents, thankfully, are still around, but they didn't plan. They don't have a long-term care plan, which makes myself and my wife their long-term care plan, if you know what I mean. So it's very common for, some of your clients that may be in their 40s, 50s, their parents are still around. Maybe they want to purchase a short-term home health care plan and pay for it for their parents. So the parents are the main insureds, but the kids are paying for it. That kind of helps with the idea of I may not have to change my job or my travel schedule, or my wife who travels every week in order to help take care of my parents when they need home health care. That's the kind of the idea behind that. Also, this plan's super easy to get, and we're going to qualify everybody on the call for it today right after I show you the consumer video. Let's take a peek at it.
There's no bed like your own. And if you suffer an illness or have an accident, the last thing you would want to do is recover in an unfamiliar, hectic environment like a hospital or nursing home. Focus on your recovery in the comfort of your own home with short-term home health care insurance from Guarantee Trust Life Insurance Company. Think about your family situation. You may be reaching that age where planning for future care is necessary, or maybe your parents are reminding you they don't want to go to a nursing home. How could being unprepared for either yours or your parents' need for care affect your finances and way of life? GTL's short-term home health care insurance is more affordable than most other plan of care policies, and it pays benefits directly to you regardless of any other insurance you have. Home health care benefits kick in if you suffer a cognitive disability or can't perform 2 of the 6 ADLs, and no hospital stay is required. The base plan consists of 3 main components, and there are 3 different base plans for you to choose from to match the level of coverage you want. With the home health care benefit, your chosen plan pays a benefit for up to 360 payments for a variety of services, including skilled nursing, physical therapy, and general nursing care. With our most comprehensive plan, you can receive up to $162,000 of home health care benefits. With the home health care aid benefit, you can receive a daily benefit for each day you require the services of a home health care aide, depending on your chosen plan, and no hospitalization stay is required. Most likely, you're taking at least one prescription medication. With the prescription drug benefit, you can receive benefits for any prescriptions that are filled after the policy is in effect. Just filling your normal prescriptions can help offset the cost of the policy itself. Now let's see how it works. Say you're 65 years old, have the plan A policy, and take one brand name prescription that you refilled 12 times over the years. GTL's short-term home health care insurance would pay you a total benefit amount of $300 over those 12 months. With an annual policy premium of $365.68, the net cost of the policy would be less than $6 a month. And this is not even including any home health care benefits you may receive. Policyholders also have access to TCare's concierge caregiver support services and a $3,500 family caregiver benefit. Short-term home health care insurance from GTL is flexible and customizable with a great set of riders for you to choose from. And with only 2 or 3 underwriting questions, you don't have to worry about a long application process or medical exams. So, for a fair premium, wouldn't you rather receive professional care at home? Now is a great time to find out more about GTL's short-term home health care insurance.
All right, so great video there. Here's a thought for you. A lot of agents who prospect with this video, think about putting that link to the video on social media with a sentence or two that you can compose yourself about, the plan, or if you're looking, if you don't have long-term care, let's chat about a short-term care or home health care plan. Great way to prospect with that. Also, just really incredible. Show it to your clients. Most of them say, wow, this really makes sense. How much is it? And sign me up. Speaking of signing me up, if you want plan A or plan B, you only have to answer the first 3 application questions, no, and you get the coverage. That's the extent of the underwriting for this product. So if you're not in a home health care facility or assisted living facility, a nursing home facility, not getting home health care at home, and if you do not already have an issue doing your ADLs, or you have not already been diagnosed with a cognitive impairment or some form of memory loss, you can get this plan. I'll point out to you, very important, there's no questions on here about do you currently have cancer? Did you just have a heart attack? Did you just have a stroke? Are you an insulin-dependent diabetic? There's nothing in there. So these are the only application questions that are there. So that may open up your eyes to, wow, you could really sell this product to a bunch of folks who really need it, and there's not going to be a lot of hindrance in terms of them getting it. Now, some of the upgrades we put onto this plan, first off, is the prescription drug benefit. We did upgrade that. If you look at the right side of your screen, that used to be $300, $600, and $600. So on Plan C, our largest plan, we increased the amount that you can get annually for taking your prescription drugs to $900 per year. And I'll point out to you that it doesn't matter if you are paying nothing when you pick up your prescription drugs, or if you're paying $2.50. It doesn't matter. Every time you refill a prescription, you get $10 from GTL if it's generic, and $25 if it's brand name. So depending upon the plan you choose, though you can see you can either get $300, $600, or $900 per year. Okay, with regard to the short-term home health care, when you get that home health care coverage to kick in, something does have to happen after policy issue. Either you got a cognitive issue or a functional issue where you can't do 2 of your 6 ADLs. So the thing to know about that, 360 days of coverage. What's even more important than that is it's 360 days. Take as long as you want to use those 360 days. It's not tied to a calendar year. So once you go on claim for this, You don't have just 360 days. You can take as long as you want to use those 360 days of benefits. And depending upon what you're doing with regard to the care you're receiving, you can see there's a cash payment there for each type of home health care there that is covered. Now, this plan does have a restoration feature, so if you do use it a little bit or use it all up, but then you recover and not need home health care services for 180 consecutive days, you do get a full restoration. So even if you don't get a restoration, look at the benefits there just for home health care: $54,000 for Plan A, $108,000, $162,000 for Plan B and C. So a lot of coverage, even if you don't have a restoration. And remember, you've got that prescription drug benefit too. That is a separate component that you're getting money from GTL for. Now, here's the third component, and this was another upgrade, home health care aid. That's the third component here. So you got prescription drug, home health care aid. The home health care benefits for the aid used to be 40, 80, and 120. Now you can see it's 50, 100, and 150. We're going to get into this a little bit more right here and show you that these are the per day benefits with Plan A, Plan B, and Plan C. The big exciting change that we made with this product is right here, 360 days. Our former short-term home health care plan, the benefit for home health care aid was only 60 days, but now it's 360 days. So that third component, home health care aid, now with Plan A, you got a max benefit of $18,000, $36,000 with Plan B, and $54,000 with Plan C. So that's a major upgrade that we've made with the plan. And again, this was a benefit upgrade that agents asked for very shortly after we launched the plan in 2018. But now that we've had 5 years with the plan in force, claims experience to look at, we see, you know what, we can increase that. And so that's what we did last year. There's a restoration on the home health care aid portion too, which works exactly the same as it is on the home health care portion. So home health care aid, home health care, all have that restoration feature. Just a quick review. Everyone asks who can perform the care. And by the care, I'm talking about the speech therapy, the physical therapy, the specialized care, or the person that's doing the home health care aid, helping them take care of their ADLs. That needs to be somebody who is licensed or certified in their state to do that, and also works for an agency that can send us a bill letting us know the details of each time they went over there and performed the home health care services. Pretty simple. Now, something that is brand new is that T-Care portion, which you saw the video on. So think of it this way. We've got home health care taken care of by professionals, home health care aides, professionals, and then sometimes you have a family caregiver too. And this is what's new to the plan. The family caregiver can get a $3,500 cash benefit, really the check sent to the policyholder, and the policyholder can give it to whoever they want. And then they also get the T-Care support benefits. And if you have ever had anybody that you've taken care of, you know, excuse me, how stressful that can be in terms of burnout. So T-Care is a company that specializes in helping the family caregiver not get burned out, help them find opportunities for assistance in their area. And let's take a little quick look through video what T-Care is all about.
Hi, my name is Ali Ahmadi, CEO of T-Care. About 7 years ago, my wife and I became caregivers to my mother-in-law that was diagnosed with stage 4 lymphoma cancer. We became aware of this term known as family caregiving. As a former naval aviator, I was trained to navigate myself through extremely hard, difficult situations. Caregiving was one that I found myself lost in. T-Care was born as a solution to help family caregivers navigate all the challenges that they go through when they are taking care of a loved one. We are born out of an academic research project that through 7 years of 2 sets of clinical trials, over 15 years of longitudinal data, led to our algorithms understanding for families what solutions at what time, what place are the most effective to help them. My wife and I thought we needed respite or home care services in our caregiving journey. But when we went through the TCare algorithms in the process, what the system identified was that we needed marriage counseling because our risk factor to burnout was a toll that caregiving was bringing on our marriage. And that's what had led us to start thinking about placing my mother-in-law into an institutional facility. And so the process of what TCare works is we engage families, whether the policyholder and the family caregiver, the primary family caregiver, typically spouse, daughter, son. The process to use TCare is extremely easy. It takes 90 seconds on a web portal or a platform to fill out a form. And through that, one of our social workers and our TCare specialists connects with those families. And through a 25 to 35-minute consultation process, they help them navigate through all the resources that they need at any given point in time. To receive the TCare Family Caregiver Support Services, it is extremely simple. We are either a phone call or a text message away for families. There's no claims process. There's no adjudication. Families can have access to the TCare benefit starting day one of owning the policy. TCare is here for you and your clients to empower you to bring a family support system so that families don't ever have to be challenged with the burden of caregiving. And they are spending more quality time with their loved ones.
All right, I think that gives a pretty good explanation of the plan, and a couple things to just kind of mention here, and this is just my own opinion. Obviously, the $3,500 benefit that the policyholder can give to the family member who's helping take care of them is great, but at the end of the day, if you have really ever cared for a loved one, a parent, and it's just all on you, the pressure from both your everyday life and also trying to take care of them and try to take care of them the best way you can, it's just incredibly stressful. So TCare is there to help, whether it's that initial call to let you know what may be available in your area for support, whether it's calling to vent because you're stressed out. You know, this is all about what TCare does. And one of the great things that TCare has been able to prove, which is astounding, is in their 7 years, they've been able to show that by using their services, they've helped delay the person needing care from being placed into an assisted living facility or a nursing home by 18 to 24 months. So when you think about that, is everybody would rather get better at home or spend as much time at home as they can before they need to go into a facility. And TCare really goes a long way to help that out. This benefit here, the TCare benefit, no other carrier has this. There's other carriers out there that have home health care plans. Nobody has this at all, which is very common. When you get GTL, you generally get some bells and whistles that nobody else in the market has. This is a really big one. One thing to know, just a little refresher, this plan does go up in price, not every year, but about every 5 years. And once you buy the plan and you go into the next age range band and your policy hits its anniversary date, that's the day that the rate would go up. To give you an idea, if I bought it at 65, plan A, I'm paying $22.87. When I turn 71 and then my policy hits its anniversary date, my rates will go up to $31.18. So depending upon when you're buying this plan, whenever it is that you go into the next age range band, and then your policy hits an anniversary date, that's when it's going to go up. With the TCare benefits, the cost of that, once you buy this plan, at whatever age, your rates do stay the same for the TCare benefit. So if I buy this at 65, my rate's $5.94 a month, and that stays the same. So with regard to one of the reasons why I mentioned that there's no questions here about have you been in the hospital lately? Are you insulin dependent diabetic? Stuff like that. Well, one of the reasons why I brought that up is because we do have a hospital indemnity rider here, and a lot of hospital indemnity plans, they do have a guarantee issue range, but for the folks that are not in that range, they're probably not going to be able to get hospital indemnity coverage if they've got insulin-dependent diabetes. So you may want to take a peek at this hospital indemnity rider because this is a rider that they would be able to get because they'll be able to answer these application questions no, and they'll be all good to go. Just wanted to mention to you really quick. The plan also does still have the ambulance rider, the critical accident rider. We did change the return of premium rider. This rider used to be, if you die before the age of 86, your policyholder is going to get the premiums they sent to GTL, less any claims paid, and of course those would be paid to the beneficiary. However, what we did change on the return of premium rider, we actually made it better. Basically now it's whenever you die, for whatever reason, your beneficiary will get the premiums that you sent to GTL, less any claims paid. So I'm going to throw out one caveat here for the return of premium rider, which I always mention. So I like to be 100% transparent. So when I say the beneficiary is going to get all the premiums paid to GTL, less any claims paid, less any claims paid does include the prescription drug benefits that they did receive. So keep that in mind. If your client is going to use this return of premium rider and they're really going to use their prescription drug benefit a lot, there may not be a lot left. So you might want to reconsider getting the return of premium rider at all. Okay, last thing I wanted to cover, and then we'll see if we got some questions. Always cover this. How easy is it to get your prescription drug benefits? Really simple. You take your prescription receipt, you know, the one that's stapled to the bag or comes in the mail that shows your name, the pills you're taking, how many were in there, the date it was filled. You send that to GTL. You write your GTL policy number on it somewhere, and that's it. You can send them one at a time. You can send them monthly. You can send them yearly. You can even go to CVS or Walgreens and ask for a printout at the end of the year of all your prescriptions and send that to GTL. Send it to GTL, we cut you the check, and we send it right to the policyholder. So that's there's no claim form to fill out for the prescription drug benefit. So really about as easy as you can get. If you're going on claim for home health care or home health care aid services, you're going to fill out a short claim form, turn in a plan of care that's filled out by the nurse or the doctor, and you're going to include your first bill. And then when your next bill comes, let's say next month, we do not need another claim form. We don't need another plan of care. We just need the bill. So keeping it simple there. Same goes for any of the riders. You fill out the short claim form, you turn in the bill. So the claim process for this plan works very well. Prescription drugs could not be easier. And, you know, we're always here in sales support too to answer your questions that you have. Couple things, if you have a second, you got your phone, take a screenshot of this PowerPoint slide. And if you don't mind, put my name, Greg Esposito, and my email address into your phone. The best way to get me in terms of getting a quick response is via email. So if I'm out traveling or doing a training, when I get done, I can quickly respond back. But if you need to talk to somebody quickly, 800-323-6907 is sales support, and their email address is agency@gtlic.com. And while the lights are on in the building during the week, you can also text to chat them at the same 800 number. So that's what we wanted to cover today. And Lynn, if you got some questions, we can play Stump the GTL Sales Guy.
All right, that sounds like a fun game. Although I was even able to answer one of them. So there have been a couple questions submitted. One of them that we had received was whether or not this short-term home health care plan was available for quoting on STHHC. And because I use STHHC myself, I can confirm that yes, this plan is available for quoting on quoting and comparing on STHHC in the states in which it's approved. So yes. The next question, is it possible for Western states to be approved for GTL, home health care, or other caregiving benefits? This is being asked by a gentleman, I believe, who is based out of Washington or Oregon, if I'm not mistaken.
Well, let me pull this slide up here. I'm gonna exit out of this for a second so I can pull up the slide that I'd like to show you, which we showed in the beginning, which is a state approval chart. There you go. Okay, so when we look at these states here, just look at all of them in total. Those are generally the states that we will be able to attain coverage in for this plan. And the ones that are highlighted in teal already have the latest plan, which we chatted about today, available. The states that are not on here, we have probably already tried to get the product approved. And some states, believe it or not, some states haven't written their short-term care guidelines yet. Most of them have. So sometimes there's a state that has a particular guideline that doesn't fit with this product, so we cannot get it approved there. And then there's also some states that have adopted some short-term care requirements that require the carrier to have their product fit into and accomplish all long-term care guidelines, which makes it difficult for us to get the product approved, because this product's designed as short-term care, not long-term care. So basically, long story short, I don't see us attaining additional states outside of what we have on the screen here, but I do anticipate in the next couple months having these states that are not highlighted become highlighted, so that we should have our newest product approved in the next few months. Hopefully that helps.
Yeah, and I totally agree. You know, the short-term care policies, we've seen a shift over the past year. I mean, it's a rapidly growing market, but there's always going to be some states. I'll pick on the California and New York and Florida. There are just some states that are well known in the industry for it just being so difficult to get things approved. So obviously it is more difficult in states like I mentioned, but there are a couple others that do have some extra requirements that just delay things getting approved, or just make it where the carrier would need to make some revisions to the plan or make some changes before they'd be willing to reconsider. So always keeping our fingers crossed.
Yeah, I should mention, we did have this product approved in Utah, and I believe about 2 years ago, Utah changed their short-term care guidelines, and so we had to pull the product, but we have filed a new updated product in Utah that would fit within their requirements, and we've been working with them for probably a good 6 to 9 months now, but sometimes the approval process is really slow. So I guess I should take back what I said. We'll probably see Utah come back on the board here, hopefully sooner than later.
Yep. Perfect. So the next question is reimbursement or cash benefit.
Mm-hmm. So basically, the first thing I should mention is anytime we pay a claim on this plan, whether it's a prescription drug or whatever it is, we always pay based upon their GTL coverage. So we're never coordinating coverage. If they've got, $500 due to them, based upon their GTL coverage, we're paying $500. We don't even know what other coverage they have. We don't know what kind of Medicare coverage they have, if any. So we always pay based upon GTL coverage, and we pay via check to the policyholder, and then they can use the money for whatever they like. And so that's basically, I think that should answer the question. That's just basically how it is.
Okay. The next one is, how many times may a person use restoration of benefits? Is it only once or more?
It's once. Yep. And
One
the nice
time.
thing is that it's a restoration possibility for home health care aid, and the T-care benefit. So those things all restore.
Wow.
A good example would be, somebody may just, have a hip replacement or knee replacement, or, they're going to use some home health care or home health care aid for a while. And then, they're going to recover most likely. And then after 180 days of being recovered, not needing that, they get a full restoration. So that works out really nicely. Where it doesn't work out nicely is where somebody, unfortunately, they're using this plan and going on claim for something that's not curable yet, like dementia. If you've got dementia, there's no cure for that yet, unfortunately. So once you use up your 360 days, you're not going to have that 180 days of recovery. So it won't restore. That's basically how it would work.
Mhm. All right. The next one is, a comment. I like that it is 360 days and not 360 days and then the plan is over. So referring to you can use those 360 days over however long you need it, as opposed to it being
Yep.
tied to a calendar year.
Yeah,
We have,
and these components are all separate too. So, you could use 360 days of, home health care and then use 360 days of home health care aid. They're separate. It's nice.
all right. Does TCare have a website? Not finding in a quick search.
Okay. Yeah, I'm sure they do. I'll send that website link to you, Lynn, and then you can forward it on if you don't mind. Yeah,
Okay.
I'm sure they do have a website. Yeah, I know they're based out of St. Louis, Missouri, is where their main headquarters and where their support staff is at.
Okay. And just so all of the attendees know, we will be sending up a follow-up email, so I'll just be sure to include that link when the email goes out. I have a final slide that I'll turn to just as we're about to wrap things up, but it'll either go out later today or even tomorrow, so just be on the lookout for your email. All right. Oh, an earlier question, it was clarified it was Washington State that they were wondering about on the western side.
Yeah, I think
Okay.
Washington's already a no-go. It's not going to happen.
Oh, all right. I think there's one last one. And I think you did actually cover this a little bit. If client has an existing short-term home health care from GTL, could they add
Mhm.
this new contract and keep both? Oh, this is a little bit different. Having both an old plan and a new plan would both pay claim.
Okay, well, great question. So anytime we've got GTL products and people want to increase theirs or add another one, what we do is we definitely limit the amount that they could have in total to be the maximum amount on one. So if they wanted to have two plan A's, the maximum, that falls under the maximum. So it is possible. What we are seeing though is we're seeing people who want to have the new TCare benefit, and they're actually just replacing their existing short-term home health care plan. So that is available, but you would not be able to buy. Let's say you can't buy two maximum policies. Both of them would have to add up to our total maximum for one.
And if I'm not mistaken, I believe that total maximum is 450 because I believe we run across this even when, because we train agents to stack policies in some cases too, selling the short-term care, the Recover Cash, and adding this standalone home health care plan. There is that daily maximum, or there's that maximum home care benefit. I believe it's $450.
Yeah, for the home care benefit on the short-term home health care plan here that we're chatting about, the maximum is $450 per day. So you wouldn't want to go ahead of that. And with Recover Cash, that plan goes up to $1,400 per day. So there's definitely, and then with this home health care that we're chatting about today, that home health care aid benefit goes up to $150 per day. So when you add both of those up, you'd want to stay under the $1,400. But if you've got the Recover Cash plan and this one. But yeah, for purposes of just chatting about short-term home health care, you're right, $450 per day for home health care would be the max.
All right. I believe that is all the questions that we have. We have a couple thank yous. It looks like someone may have actually found the website tcare.ai. I've not confirmed, but again, we'll be sure to include a link in the follow-up email. Greg, it is an absolute pleasure. Thank you so much for coming on today and being willing to share the enhancements about this plan. And in fact, the video that the first video that you shared, um,
Hmm.
I thought it did a great job, even going and covering some of the basics. So
Yeah, for
it
sure.
may not have been the full presentation, but I thought it did a really good job to establish at least a baseline for what, if someone is not necessarily familiar. It was a pretty good overall um, information
Great.
packed video.
Great. Well, that's what we try to do. And the nice thing about that video, once you have the link to it, and you can actually download that right onto your desktop. So you've just got it a click away. The video takes you to a Vimeo site, and you can download it right there. Just so you always have it if you want, or you can copy the link to it and put it on social media. Anything like that works really well.
Now, correct me if I'm wrong, there is a QR code on the front cover of the product brochure. That too
Yep.
points to the consumer video. So it's
Yep.
accessible even if you're not even at a computer. Most people nowadays have some type of smartphone. So I mean, take advantage of that. Your client can get that short information packed video, be brought up to speed very quickly about how the product works in general. And then it just makes your job so easy.
Yeah, I've as you can tell, I've done a lot of trainings on this and our other plans. But if I were with all of you today, I'm sure there would be one of you, if not more, raising your hand and saying, I play the video for clients, and they pretty much just say, how much is it, and sign me up, because the video does such a great job. It's pretty cool.
Good deal. All right. Well, again, thank you, everyone. Greg, thank you so much for your time today. I appreciate everybody coming on for this training. And if you haven't visited the Golden Care website yet, be sure to visit goldencareagent.com. We have a lot of materials out there, some information, including the STRATECISION tool that allows this plan to be quoted and compared. We have product materials and different pieces of information, especially on this short-term home health care plan. So again, thank you everyone for joining us, and I hope you all have a wonderful rest of your day.
Have a great day.
Golden Care is always here to serve you with new tools, new products, new ideas, and new innovations, and always the best support in the business to help you succeed. So give us a call at 800-842-7799 and check out our website at www.goldencareagent.com.